I'm really curious how you greet a new patient. Someone who's never been here before. Maybe you've spoken with them on the phone once or twice, but they walk in the door. What's going through your mind about somebody who maybe they're coming in for an initial consultation and might do a significant amount of work? How do you treat that person who comes in?
We treat that person like a human being. I greet them with a smile, try and make them feel very welcome, ask them if there's anything they need. We have a coffee bar. I offer them snacks and refreshments. And most of the time I'll come around and greet them personally rather than sitting behind the desk and welcome them to the Flax Dental family.
Are some people who have not seen a dentist for a while, are they nervous when they come in?
Yes. One of the things I will tell you, for patients that are established, our hygienists and our dental assistants and Dr. Flax do a great job of putting notes in their files when there's a high fear patient. They also put things in like the patient prefers a blanket or a pillow or something like that. We try to accommodate all their needs. High fear patients we're very gentle with. We try to make them feel comfortable, lessen their anxiety, and walk them back and introduce them if they haven't been with a particularly new hygienist before. Anything we can do to mitigate their fears and make them feel welcome and at ease is what my goal is.
And do you have a sense that is effective, that works? Do you see a transformation when they walk in, oh my gosh, and then finally they're breathing again when they walk back?
I do, because if you take time to talk with them, find out how's it been going, what's going on in your life, how are the kids, we try to make sure we get to know our patients enough to know some people are dog people. They want to talk about their dogs. Some people want to talk about their children. Have they been on a trip recently? Do they have a trip planned? Just generate some kind of conversation, and you can just see their shoulders relax and they get it a little easier.
Do you have advice, maybe that you deliver to the patient, but that you might be thinking of now, for how somebody might psych themselves up to come to the dentist if they really are fearful? So let's say it's the evening before they're ready to go to bed, or it's the morning of the appointment, they're ready to come to the office. Is there anything they can do to prepare?
I think people who have really high fear, I think it's a matter of taking a lot of deep breaths. I think in terms of there's really nothing you can do right at that moment but relax and make yourself a little calmer, because that's going to make the appointment a lot easier. Like I said, if we know in advance they're a high fear patient, oftentimes there's some medication that can be prescribed to help them out, and Dr. Flax can do that as well. But I think trying to make people at ease is just something that I feel is the number one thing in my job. So whatever I can do to do that, I will do.